Hello, aspirants, and welcome to today's Explainer. We're jumping right into a crucial medical shift today, moving from PCOS to PMOS. It's a topic that sits absolutely front and center for your GS2 Health and GS3 Science and Technology papers.
Absolutely. It's a perfect case study of how a simple change in medical science can profoundly impact public health governance and social justice. We're going to break down why this nomenclature shift happened, the core science behind it, and exactly how you should structure this information for your mains.
To really grasp the gravity here, we have to look at the sheer scale. We're talking about an estimated 170 million, yes, 17 crore women globally affected by this condition during their reproductive years alone. That's not some rare anomaly. It's a massive, critical public health issue directly impacting global health systems and our workforce demographics.
Exactly right. When you have 17 crore individuals dealing with the condition, any gap in diagnosis is straight up a governance failure. And that brings us to the fundamental flaw in how we've historically managed this.
The most concerning part is the immense volume of missed cases. Right now, diagnosis is based on international guideline criteria where patients need to meet at least 2 markers. These include irregular or absent periods, high male hormone levels, which you might see as excess hair growth or detect in blood tests, and polycystic ovaries on ultrasounds. But here is the kicker. Despite those established criteria, up to 70% of affected individuals remain completely undiagnosed. 70%. For your GS2 answers, that is a staggering statistic. The broad clinical reality of this condition just isn't being captured, leading to massive systemic diagnostic delays.
So, what's the root of the problem? Well, the name itself has been a major barrier. The Endocrine Society, which is a global body of hormone scientists, has decided to rename Polycystic Ovary Syndrome, or PCOS, to Polyendocrine Metabolic Ovarian Syndrome, PMOS, because the term PCOS is, quite frankly, highly inaccurate. It forces patients and doctors to focus purely on cysts in the ovaries. But research shows that while arrested follicular development is common, actual ovarian cysts aren't even increased. PMOS captures what's really going on, a deep underlying endocrine and metabolic dysfunction.
And we can see this ground reality right here in Indian clinical practice. Take a look at what Dr. A. Jayshree Gajaraj, a senior obstetrician gynecologist based in Chennai, has to say. She entirely welcomes this move because the old name misled even seasoned medical professionals into thinking ovarian cysts alone equate to PCOS. Plus, she rightly points out the dangerous rise in erroneous self-diagnosis. When the terminology is flawed, the entire public perception is flawed. By shifting the name to PMOS, we redirect the clinical focus to where it actually belongs, which is going to aid in much faster, accurate medical interventions.
Now let's connect this to your GS3 Science and Technology Foundation. You simply cannot write a one-dimensional answer here. Mounting research shows this condition is driven by deep endocrine disturbances involving insulin, androgens, and neuroendocrine hormones. Spot on. You have to bring in these multi-pronged features for a complete answer. It is heavily metabolic, linking straight to obesity, type 2 diabetes, hypertension, and abnormal blood fats. It's reproductive, causing infertility, pregnancy complications, and even endometrial cancer. And let's not forget the severe psychological features. This is a complex, systemic issue, not just a localized problem.
Pivoting over to the GS2 social justice angle. A paper published in The Lancet by Helena J. Teed and her colleagues makes a strong case that dropping the word cysts greatly improves accuracy. But it's so much deeper than clinical accuracy. Historically, society has boxed this in as merely a gynecological disorder. That hyper-focus on reproduction reinforces intense social-cultural stigma, especially in societies where a woman's fertility holds disproportionately high social value. Renaming it PMOS validates the true metabolic reality and is a huge step in actively breaking down that stigma.
So, how is global health governance responding? For your mains answers, you always need a way forward, right? Well, a global implementation strategy is reportedly already rolling out.
It boils down to 3 main steps. First, a formal transition period to gently phase out the old term. Second, extensive education for both the medical community and the public about the true metabolic and endocrine realities of PMOs. And third, a rigorous alignment with global health systems and disease classifications, ensuring that policies, insurance, and treatment protocols are universally updated.
Let's wrap up today's Explainer by putting you in the hot seat for a UPSC personality test. Imagine the interview board asks you, how does medical nomenclature impact health governance, diagnosis delays, and social stigma? Discuss this in the context of the recent shift from PCOS to PMOS. Aspirants, this is exactly where you synthesize the whole picture. Bridge the hard science of endocrine disruption with the social realities of diagnostic gaps and cultural stigma. That ability to connect the dots is what gives you the true analytical edge. So, take a moment and think, how would you answer that question before the board?